Hi everyone, John Connolly, President of the Twin Cities North Chamber of Commerce. And this is Chamber Check-In, your source for virtual networking, great local content, and ways to connect with local businesses and build relationships. Hey, we're glad you joined us here on Chamber Check-In today. We have two great guests during this State Fair Week Chamber Check-In. First of all, though, a shout out to the 9 North team that produces Chamber Check-In. We appreciate their partnership. And second, for all things chamber related, go to twincitiesnorth.org. That's twincitiesnorth.org. And there you'll find all sorts of ways to connect with local businesses and find ways to connect with other solution-based companies like the two we're going to interview today. And now, let's get right to our program here. Our first guest today is Jacqui Sauter of Keller Williams Integrity Real Estate. Jacqui, welcome to Chamber Check-In. First of all, for those that don't know about Keller Williams, tell us a little bit about it.
Sure. So Keller Williams Realty is a large international realty organization. I happen to work out of the Roseville office, and we have about 200 agents in that office alone, which always cracks me up because people will always say, oh, do you know this agent or do you know that agent? And then when I explain that there's 200 agents just in our office, they understand why I don't know every agent in the Twin Cities metro area. But so that's a little bit about KW.
So for those that, there's several large real estate companies locally here in the Twin Cities area. I won't name them, but what makes Keller Williams Integrity Real Estate a little different than the others?
Well, Keller Williams specifically focuses on training for their agents. So that's why I gravitated toward them when I was looking for a place to land with my career. They are so supportive of their agents and training, and which is key because that training then transfers over to our ability to do the best job we can for our clients. They really focus on that relationship with those clients and being the go-to agent in all aspects of the transaction. So that's really what sets them apart.
Interesting. So now let's, thanks for telling us that story. Now, describe for us the current market, and then we'll have a follow-up question about where you see the market going, because you deal in primarily residential real estate, right?
I do. We do have a commercial division as well. So for anybody looking for some commercial help in real estate, I am able to help in that regard, but my focus specialty is residential. There's been a lot of changes in the last few months, very recently in real estate. I'm sure a lot of you have heard that. So the good news is it is still a seller's market. So those of you who are on the fence about selling your home, it's still a great time to do so. Inventory continues to be low, but we will see that tick up here in the next few months. So interest rates have also been a roller coaster for those of you that have been watching the interest rates. They go up and then they come down a little bit and they go up a little bit more. So that really affects your payment as a buyer. But in the grand scheme of things, interest rates are still relatively low when you look at past interest rates and where they've been. So it's also a pretty decent time to buy.
Great. So good time to buy, good time to sell. Lots of positive news there. For our area specifically, Jacqui, this Roseville, New Brighton, Arden Hills, Shoreview. What can you tell us specifically about this area that contrasted to the rest of the metro area?
Sure. So for our area, we have a lot of activity. There's you're going to see more homes coming on the market. We see a lot of long-time home buyers that are looking to sell now. So a lot of our neighborhoods are aging. You'll see people who have been in their homes for 50 plus years that are now looking to move on. So that's one thing about our demographic area that's kind of unique. We do have a lot of aging neighborhoods and a lot of younger families kind of moving into those neighborhoods. So the turnover is kind of fun and exciting to watch in our neighborhoods alone. So there's also just a lot of building. There's a lot of building going on in our footprint of the chamber. So when you see all these high rises happening and lots of activity and building and those things going on, it means it's a busy market. People are kind of moving around, and even rentals are pretty popular too with a lot of the millennials. So it's just a very interesting place to live and work where we're located. But again, if you're looking to buy a house, you're gonna have a good chance of getting in to a home that might be a little older, that might need a little elbow grease to get
Sure.
that up and running and get it to be the home of your dreams.
Yeah. So speaking of things to look for in a residential home, is there one or two key things that buyers are looking for? That they're saying we've got to have this, or this is something that we really need to see in our future home. Is there a couple of clear things that you can share with us?
You know what, John? That's very specific to the buyer. So what you want to do is you want to find a really great agent, because that great agent can dig down deep and get your wish list of things that are very important to you when looking for a home. So they're going to get to know you very well, and things that are deal breakers in a house. So, get a great agent on your side, because they really are your right arm, and they're the ones that are key to navigating this crazy market, because it is hard. It's very hard, and it's hard to keep up on all the changes. So, rely on your agent, go to them, because they're a bigger resource than just real estate. They also know those people that can do painting and drywall and floors, carpet removal and redoing wood floors. We know all those people, so we're a great resource for you over and above just the real estate transaction alone.
Got it. Okay. Well, hey, good advice for anyone out there who's either buying or selling. Consult with that real estate expert, and you'll be able to find your way and navigate those things. Hey, we have about 30 seconds left here in Chamber Check, and I know, for full disclosure, everyone, Jacqui Sauter is going to be our new chair of the Twin Cities North Chamber of Commerce. And Jacqui, tell us your last thoughts that you'd like to share with everyone. As you're doing a dual role. You're a real estate agent with Keller Williams, but then also now you're going to be our chair of the Twin Cities North Chamber.
I'm very excited about it, John. Thanks so much for the opportunity to be the chair of the board for the 2022-2023 season. I think we're positioned in a great way to grow this chamber. So that's kind of my challenge to all of our current members out there. Each one of us, go out and reach one. Go find someone that you think might be a good fit for our chamber, and share your story as to why you continue your involvement and what makes this chamber great as all of us. And I'd like to see us grow and get to the next chapter and just be bigger and better than we were even last year as far as membership goes.
Sounds good. Jacqui Sauter, Keller Williams Integrity Realty. Thanks so much for joining us on Chamber Check-In. And next, we've got Kate Fuchs-Lechner from Allina Health up next. And speaking of board members, you're our most recent addition, Kate. Welcome to the team.
That's correct. Thank you so much. I'm really happy to be here and excited to be part of the board.
Yes, absolutely. Now, for those that aren't familiar, Allina Health's a big healthcare network. Give us a 30,000-foot overview of Allina Health and what you provide to the community.
Sure. Allina Health is a not-for-profit care system serving patients from birth through end of life. We are dedicated to preventative treatment of illness for our patients, families, and communities in Minnesota, throughout Minnesota and Western Wisconsin. We have more than 28,000 employees, I believe about 6,000 associated and unemployed physicians. We have 10 hospitals, over 90 clinics, 52 rehabilitation locations, as well as about 15 pharmacies and 2 ambulatory care centers. So really large healthcare presence throughout Minnesota and Western Wisconsin.
Absolutely. Wow. I mean, the scope of that, just those statistics are staggering, the impact that a healthcare system like Allina Health has in our community. Speaking of community, Allina has always been involved in the community. Tell us a few examples of those sort of things where Allina Health steps in, besides providing quality health care at an affordable rate.
Sure. Well, we have a lot of different programs that help to meet the needs of our community. I think of even something like our Free Bikes for Kids program that we do every year to help provide thousands of bikes to kids across the metro area. That's a really fun program to be a part of. Also, our Unity campus of Mercy Hospital, which Unity is located in Fridley, we're really involved there in Meals on Wheels and providing low-cost meals to members of our community who may otherwise go hungry or have food insecurities. So we produce well over 100,000 meals for our community out of our Unity kitchen annually for our Meals on Wheels program, and that serves basically the same communities that Twin Cities North is serving. So
Absolutely.
that's a really fun program to be a part of.
Yeah, how rewarding! They just like you said, you got the bike program and you've got the Meals on Wheels program. Great assets for this area. Appreciate that contribution and donation and all the resources that Allina Health does to support those groups. Hey, everyone wants to put COVID in the rearview mirror, Kate. It seems. What trends are you hearing from your system about where things are going, maybe with COVID, and then also what plans are being made for the upcoming months?
Yeah. I do think as a broader community, we're definitely ready, a lot of us, to put COVID in the rearview mirror. I think a lot of what we hear in the healthcare world is that we're ready to be done with COVID, but COVID may not be ready to be done with us. I think we're continuing to try and plan for the worst, but hope for the best. If it's not COVID, what might be coming down the pike next? I think healthcare is really in an unprecedented time. I know that word gets thrown around a lot, but I do feel like we've made it through probably hopefully the worst of the COVID pandemic, just in terms of impact to wellness of our communities' lives. Also, just all the unknowns and uncertainties that it posed for our healthcare system, the wrenches it threw into our supply chains, and just needing to source, things like PPE for our staff. There were challenges that we had never faced before that we had to sort of navigate these last few years. I think what we're dealing with now in healthcare is really the fact that the pandemic has intensified a long-running healthcare worker shortage for us. So I think if you talk to healthcare leaders across the nation, they would probably put workforce stabilization in their top 3 most important things to work on in the coming years. I think we really have probably burnt out a lot of our healthcare workers, and just figuring out how to fill gaps and how to sort of rebuild our workforce and re-energize them and support them as best we can is a priority.
Well, I'm so glad you told that story, because that's something I'm hearing out in the marketplace too as well. So about folks that are working in healthcare and provided those services. I'm always amazed about how we all adapted quickly, especially the healthcare industry, with all the changes that occurred bing, 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 and how quickly things adapted. And that's a tribute to how nimble the healthcare industry was moving forward. So congratulations on that. One last thing I'll touch on is everyone's curious about telehealth. And with all people working from home, being able to Zoom in like we are today, how is that, where is that place moving forward in the healthcare industry?
Yeah, I think it'll be interesting to see where that goes in the long run. Definitely, the pandemic, I think, sort of pushed us along in that progression of sort of transitioning more care that we could to sort of the telehealth setting. And we've heard from patients that at least for certain ailments, it's really the preferred way. It's much quicker, it's more convenient. Even for things like mental health visits, I think it's a convenient way to be able to get in touch with providers and get those services that you need. As we plan for the future, for the next 5 years, I think we're definitely seeing planning for more growth within the telehealth space. I think that will continue to be a way that people want to provide care and receive care. I think probably that it can only go so far. I think there is an element of that face-to-face touch and piece that may get lost in translation there that I think is really important too. So I think finding that balance will be important going forward.
Excellent point, Kate. Hey, we have about 30 seconds left here in Chamber Check-In. Tell us your last thoughts that you'd like to share with everyone.
I think it's a really exciting time to be in healthcare. Obviously, there's a lot of challenges, but with the challenges, we have a lot of opportunities. And just really looking forward to the opportunities to continue to serve the communities in the North Metro.
Absolutely, and Kate's going to serve on the Chamber board here, and that'll be one of our community services over the next 3 years. So Kate, we appreciate you donating your time to that. So, hey everyone, we want to thank once again Kate Fuchs-Lechner from Allina Health, as well as Jacqui Sauter from Keller Williams Integrity Realty for joining us on Chamber Check-In on this state fair issue. And they're both going to the state fair, I guess. So enjoy, everyone, going to the state fair. And now, everyone, I just want to close here by telling everyone the vision of the Twin Cities North Chamber, and that is to promote business, develop leaders, and connect communities. And we're so glad you connected with us today. And again, a shout out to the 9 North team that produced Chamber Check-In. We appreciate their partnership. And in closing, all things chamber related, go to twincitiesnorth.org. That's twincitiesnorth.org. And there you'll find all sorts of ways to connect with businesses like Kate's and Jacqui's. Thanks so much for joining us. Have a great weekend.